Hey, Linda. Good afternoon, everyone. I would like to call to order the special meeting of the Douglas County Board of Health. I would like to start us off with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. I'd like to attorney certification of agenda, Mr. Pratt.
Good afternoon. Good afternoon, planning board members. Chris Pratt with the County Attorney's Office. Our office has reviewed the 2 items on your agenda this afternoon for this, which is a special meeting, although our posted notice does say regular meeting. This is a special meeting for Friday, October 8th. The Douglas County, the Public Health Director hiring process update and the discussion of the draft public health order. Those 2 items have both been reviewed by our office. You have jurisdiction to hear them this evening.
Thank you.
Oh, one point of order, if I may. You have all had placed at your positions here 3 items that will come into the review and discussion of the draft public health order. They will be marked as exhibits, and I will just do that now to get that out of the way so we don't have to do that later. The first item is a 3-page document with, at the top, it states public health information for consideration. That will be marked as exhibit number 1. The second is a 1-page email from Jennifer Ludwig to Doug DeBoard. This will be marked as exhibit 2. And finally, we have 7 pages of emails. I believe it might be 7 emails or slightly less. That is going to be marked as exhibit 3. That is all. Thank you.
Wonderful. Thank you, Mr. Pratt. I would like to ask for any member disclosures for items on this agenda. Are there?
I have none, thank you.
None, sir.
None, sir.
None, Mr. President.
Okay, thank you. I would like to move on to the consent agenda. Approval of the minutes for the previous meeting. Has everybody reviewed them?
Yes.
Okay.
Yes.
Are there any revisions to the document?
No.
Mr. Teal.
Mr. President, unless there are further any objections by the member of the board, I'd like to move to approve the minutes as introduced.
Second.
So noted. All in favor, say aye.
Aye.
Opposed? Thank you. Now we are down to the regular agenda, and our meeting today primarily focuses around review and discussion of draft public notice order regarding masking and quarantining. I would open the, well, let me do this, and Mr. Pratt, I'm going to put you on the spot here. Could you walk through the order and what it is that we are doing here today, just so we have that as grounding? Absolutely. And then I'd open it up to discussion. Thank you.
Absolutely. And a slight correction. Exhibit 2 is an email to yourself, Mr. President. Doug DeBoard was CC'd on that document, but it's actually to you. What you have before you this afternoon is the result of a motion at your last meeting where staff was directed to draft a potential public health order based on public comments that were received and an exhibit that was entered into the record at your last meeting. That exhibit and the public comment requested a public health order regarding an opt-out for mask mandates for individuals and a quarantine restriction for individuals as well to prevent quarantining of otherwise healthy individuals or non-symptomatic individuals. Staff has worked on that. We have worked as hard as we can to get that before you today. The order itself contains several pages of recitals that include criteria or information that may be helpful in you making this decision. The order itself is listed on page 3. It has 5 parts to it. Each of those I'll let you review for your own consideration. The remainder of the document talks about definitions and how this order will interact with other laws and requirements. I note that this law is designed to take the place of, to fill the gap between where higher authorities than us may have required masking. We do not have the authority to undo that requirement, but where higher authorities than us have simply considered it a recommendation, this would be in effect for those categories of individuals and those instances.
Thank you. Thank you. I want to note one thing just to eliminate any confusion that could exist. And I don't want to presuppose whether we're going to adopt this order or not, but I want to note that this order expressly applies only when no other state or federal mandates would require wearing a mask or quarantining individuals. It would have no effect on any existing legally enforceable mandates that have already been or will be put into place in the future by entities whose authorities supersede this body's authority, or those that are currently in place on school buses, healthcare settings, congregate care settings, correctional facilities, et cetera. It applies only in instances where masking and quarantining are recommended or encouraged by higher authorities, but are not actually required. As stated in the order itself, this is a supplement in addition to other existing valid orders and legal requirements. It is not an attempt to overturn them. In other words, you know, if the federal government has a requirement for masking in a jurisdiction or in a place, that we're required to follow that, and we can't supersede that, and we wouldn't. What we're operating is within the authority of this board and what happens within the county. So I just want to make that clear because I don't want there to be any confusion about what it is that we're doing. So with that, what I would ask the board members, do you have any questions for Mr. Pratt, or do you have any? I would encourage some discussion. Thank you.
Mr. Chair.
Yes, Commissioner.
As I was reading through this, I noticed it repeatedly talks about children. Paragraph 4 talks about regarding the masking of children ages 2 to 18 while at school. I wonder if we want to have any discussion about adults in the same setting, or if this is going to be limited only to children.
Thank you. So you are correct that this does apply to children at this point. It does not apply to, for example, teachers or staff in school, and that is within our, certainly something we could discuss and we could address in the order the board so decided. Are there any discussion?
Mr. President, I would just like to read a text that I got this morning from a teacher. He said, "Oh, just a minute. Just one favor, please. Can you include teachers in your public health order regarding school masks? I know it's different because we're employed, but I'm losing hope. And I know of 3 great teachers who are just burned out, and several are ready to walk. It's not just the masks, it's other things, but the masks don't help." He said, "Frankly, I don't get paid enough to put up with all of this that we're being put on our plate, so please help me."
Thank you, Commissioner. Commissioner Teal?
Yeah, thank you, Mr. President. You know, I received a very similar, perhaps from the same source, a very similar message as Commissioner Thomas. And that's something that absolutely I'm interested in considering. I mean, in the review, I do think that is what is missing from this proposed public health order at this time. And so, yeah, I'd be very much interested in taking it under consideration as well. And of course, would very much like to hear from the community who's joining us in person and online, and accept their comments on such a proposal as well.
Thank you, Commissioner. Any other comments? Yeah, I also would like to hear comments from the community on it before making a final decision. But I'm inclined to be in support of an amendment that would include teachers and staff in this as well. It's been a long 18 months, and I think that people are looking to move forward. And I think the state of Douglas County, our COVID transmission, I think, is moving in the right direction. So I would be inclined to support it, but I'd like to hear more comment on it. So with that, with no other comments from board members, I would like to move on to public comment. So I would invite public comment. I don't know if there's been a sign up or if we're just asking folks to queue up. Oh, there is a sign up sheet. Oh, thank you. Okay. There are several. So what we'll do is we'll go through those who have signed up in the room, and then we'll move to anybody who wants to comment who is online. First is Miles Cortez of Centennial, Colorado. Mr. Cortez. Oh.
My question, I don't have a comment specifically on the teacher thing, but it's the one chance for comment on.
I think we're taking comments on both, not just on teachers, but on the order. Mm-hmm. So if you want to make a comment on the order.
Is this only for residents and taxpayers of Douglas County, or is it wrap the whole county?
No, you can comment. No, thank you. Or we could, or just
all the public comment on the order totally now, or are we going to come back to it?
No, this is the public comment on the order. Oh, Mr. Dierenbach, why don't you go first then, and Mr. Cortez, we'll call you afterwards. Thank you. Mr. Dierenbach of also Centennial, thank you.
We are constantly bombarded with messaging claiming masks are way more effective than they actually are, and that COVID is way more deadly than it actually is. The CDC, and this was referenced in the draft order, published a study of 90,000 people in Georgia schools and did not find statistically significant difference in case rates for students between schools with mask mandates and without mask mandates. That's the CDC and 90,000 students. But closer to home, the Colorado Department of Health recently published a graph that was widely distributed where they noted that schools with mask mandates had less cases than those without. The data from that I haven't seen the data underlying that study. I can't confirm that they've taken into account community infection rates and community vaccination rates. I think it's just raw data. So I'm not sure if the difference they found was statistically significant, but let's say it was. I asked the CDPHE for their latest data, and as of September 23rd, that data showed that masked schools had a case rate of 2 cases per 1,000 students, and that unmasked schools had a case of 2.4. The difference was 0.4 cases per week per 1,000 students. In a school of 3,000 students, that's 7.2 cases versus 6. Think about what that means. We were told that schools are safe with masks and unsafe without masks. John Douglas of Tri-County, he literally told Cherry Creek schools in an email that they were unsafe without masks. And then Tri-County makes an order that says masks are necessary for the preservation of safety. Are we seriously going to believe that the border between a safe school and an unsafe school is 7.2 cases in a high school versus 6 cases in a high school? That's ridiculous. Moreover, think about what that means for quarantining. That same difference is a difference that they base quarantining on. Are we to believe 6 cases per week is so low that you don't need to quarantine? But if you go up to 7.2 cases, then suddenly you need to quarantine and deny people in-person education? It is completely absurd. Yet that's the position being held by Tri-County right now when they claim masked schools are unsafe, are safe, and unmasked schools are unsafe. Tri-County is not following their own data. They're not following CDPHE data. They are blindly following politically captured entities like CDPHE and the CDC. For these reasons, I wholeheartely support what you're doing today. It's the right thing to do for kids. And also regarding teachers, whether or not they should be masked, I want you to think about 2-year-olds in daycare settings, childcare settings, and young kids looking up at their teacher through a mask and not being able to read them, not being able to form words like they would if they could see what actions the teacher was having. Thank you.
Okay, Mr. Jimbrack, and I apologize for this. I should have asked you, for the record, provide your name and address? Could you do that now,
Sure,
please?
I thought it was on the.
Yeah, no, yeah, it is.
I thought
We're
that
doing-
sufficed, but yeah, Carl Dierenbach, Dierenbach, 7587 South Xanthia Court, Centennial.
Thank you.
Thank you.
Mr. Cortez.
Hi. Oh, could you pull up the?
And would you name, I'm sorry.
Yeah, Miles
Thank you.
Cortez, 6420 South Abilene Street, Centennial, Colorado. I've got children in Douglas County School District, and I pay taxes and I pay child support into Douglas County Schools. So I know somebody's got an issue with me speaking. But look, I want to echo what Mr. Dierenbach said. Throughout this, we've been told to rely on the data, and Tri-County Health points to CDC and CDPHE. So I want to go through this. Can you enlarge this a little bit? I want to go through this and look at exactly what this data says. So the CDC, we have pediatric deaths through 10/6 of 499 out of 6.4 million total pediatric cases. That's less than 1/10%. The CDPHE, the data that Carl just cited, says that the difference between a mass school, 100,000 masked kids versus 100,000 unmasked kids is 40 cases per week. That works out to 0.4 cases in a school of 1,000. So in a school of 3,000, you're talking about 1.2 additional cases per week. The CDPHE's data says that the total number of cases through October 6, all ages, is 685,000. The pediatric cases are 125,000. Total Colorado hospitalizations, all ages, 39,000. Pediatric hospitalizations, 3.2% of total, is about 1,250. So the summary of this is that from the CDC's own data and the CDPHE's own data is this, that you need, can you scroll up a little bit? So you have 99 cases age 0 to 19 before you have a sick kid, hospitalized kid, and you have 12,800 cases below 19 before you have a death. So what does this mean for a school of 3,000 students, okay, which is a good sized school? So in a school of 3,000 students, that means 1.2 new cases in a week. And in a school year, that's 43 new cases in a school year at a school of 3,000. So in conclusion, for a school of 3,000 students, you need to go to school for 2.3 years before you have that one incremental case that is the difference between a masked school and an unmasked school. 2.3 years to have one additional hospitalization. You have to have that school operate for 298 years, 3,000 students in a school, 298 years before you have an additional death resulting from a masking versus unmasking. It simply is not justifiable. And I want to thank you for what you're doing. And I echo the sentiment that teachers should be included in this so that kids can see their smiling faces. Thank you very much.
Thank you, Mr. Cortez. Mr. Smith, Brian Smith. Oh, you just signed in? Okay, sorry. Anything come to mind since you've been here, though? You want to talk about it?
Yeah. My name is Brian Smith, 2170 Peralta Loop, Castle Rock. I'm not going to say anything more than what's already going to be said before or after me. All I can say is thank you all. I appreciate it. Thank all of you, no matter which side you're on. Thank you for coming here and presenting.
Thank you, sir.
That's it?
Yeah, thank you.
Appreciate it.
I apologize if I get this wrong. Miss Cole? Tara Cole? Oh, thank you. Did I get that right?
That's right.
Okay.
Like the store Coles.
I didn't know if that was an H or not. So.
That's true.
Would you identify yourself and
Yes,
address?
hi, I'm Tara Cole. I live at 10052 San Pavel Court in Parker, Colorado. I wanted to start also by telling you thank you so much. I brought my son Logan today. He's 9. He's in 3rd grade in a public school in Parker. And he wanted to come and tell you thank you. He's got a little stage fright, but he's been really fighting this battle and he wants to stay at his school. He loves his school and his friends and his teachers so much. And so we just have been fighting this battle every day. And to see a light at the end of the tunnel today has just given us so much joy and hope that this year can be salvaged and just be a normal school year, which is all that anyone has wanted, I think, students and teachers alike. And so with the introduction of potentially adding teachers onto this, I think that's so beautiful and respectful. I have talked to so many teachers, administrators, librarians, crossing guards that have been so hurt by all of this, by students that they love being forced into other schools just so they can learn normally. It's very personal for a lot of people. And I've been told that bad things happen when good people don't speak out. And I feel like they have a real fear of retribution. They're being silenced. I feel like those texts that you're seeing are just such a small piece of people that wish that they could fight back, but they felt that their jobs are being threatened. So thank you for being bold. Thank you for being upfront in front of everyone. Thank you for giving me the opportunity to stand in front of everyone and say my name and my address and proudly say that I stand against this and that I'm so thankful for you. And I'm so thankful to live in this county where you hear people. And I just really appreciate it a lot. Thank you.
Thank you, Ms. Cole. And I apologize again. Popliski? Oh, Mr. Pop, was I even close?
Yeah, Poplowski, close.
Okay, thank you.
You
Would
got
you just identify
butchered
yourself for the
last time.
record, please? And here.
So, hey, thank you. My name is James Poplowski, 11989 South Swift Foxway, beautiful Parker, Colorado. I am indeed a Douglas County resident and taxpayer, so thanks for listening to me. So I'd like to start off by saying that which can be asserted without evidence can be dismissed without evidence. The latest health order that's being proposed indicates mask usage contributes to anxiety, depression, etc. However, no studies are really provided, just anecdotes from angry constituents. Speculation with no real data. A tearful story we heard last time I was here about a girl not getting a piece of candy. Obviously, a text from a teacher having a rough day. Are kids depressed and having a hard time? Absolutely. I guarantee they are. But correlation does not equal causation. A global pandemic could be the cause of issues. People being sick, losing their taste and smell, losing loved ones, being hospitalized, the news, you name it, it's out there. So all these might have more to do with the helplessness our kids are facing than putting on a fabric mask. So some studies that have just recently come out on September 24th, CDC released a report with 3 different studies, one of which was conducted in Arizona that saw schools without mask mandates were 3.5 times more likely to have COVID-19 than schools with mask mandates. 3.5 times, I love those odds. So yesterday, actually, the CDC released another study, which is kind of heartbreaking, indicating in the United States, 140,000 kids have lost their primary caregiver due to COVID-19. This is also on the CDC website. 1 child loses a parent or caregiver for every 4 COVID-19 deaths. It's awful. I mean, you guys have asked for data. The commissioners have asked for it. Data keeps coming out from peer-reviewed sources. CDC, obviously, you guys referenced the data in the health order, but you also seem to neglect some of the other things that they state as masking is effective. Kids are getting sick. That's definitely a case. Long-term effects are still unknown. Tri-County's week of admit date for September 26th had 4 0 to 5-year-olds hospitalized, 3 6 to 11-year-old hospitalized, and 5 12 to 17. I don't think there was any from last week, but that's the most recent one. That is a number 12. It's just 12, but God, I hope that's not one of my kids, and I hope it's not one of yours. Let's see, I had to chop a lot of stuff. I was about 5 minutes long. So Douglas County Commissioners' priorities listed on the public website says their goal is to keep you safe. It says that. And to protect the most vulnerable of our citizens. Kids might not be dying or being hospitalized at an alarming rate for you all. However, parents, grandparents, people with health challenges would most certainly be the most vulnerable of our citizens. Douglas County has lost 1 17 and under-year-old, 7 18 to 44, and 30 45 to 64. I didn't do the 65 plus, but you guys can look that up. I'm betting those people are parents, grandparents, aunts, uncles, teachers, you name it, they're out there. I find it hard to believe we survived all of last year with a cautious, methodic approach, and then we start this year and everybody forgot what we were doing. When school started this year, very few kids wore masks to school. And what did it do to cases? They spiked. Look at the graphs, it all lines up. Thanks for allowing me to speak today. It's probably falling on deaf ears, I realize that. I would ask that you consider a compromised balance approach. When Tri-County data drops us to a low transmission rate, we pull masks. Have it somewhat flexible, but being stern and saying anti-mask, it's scary for me being a parent of two kids.
Thank
When
you.
it climbs
If
back
you
to
would-
moderate or high,
Thank
we
you.
re-implement. Follow the whole CDC, not just the cherry pick data. Thank you, guys.
Thank you. I can get my, there it is. We have one other, Miss Nancy Domry. Oh, you just signed, okay. Okay, thank you. Do we have any online comments?
Yes, Mr. President, we certainly do. The first online comment will be from Robin Webb. Robin, you're unmuted. Go ahead.
Hello, can you hear me?
Yes, we can. If you would just provide your name and address for the record, we would appreciate it.
Yep, my name is Robin Webb, W-E-B-B, and I live at 9917 Hawthorne Street in Highlands Ranch. Thank you so much for what you are doing. Please do whatever you can to help us in the mask mandates. This is a medical decision and should be left up to the parents, and that's just the bottom line. Also, please include teachers. Our kids need to be able to see their teachers' faces. I have heard from teachers' friends, teachers who are my friends, excuse me, that it's incredibly frustrating to try to communicate with kids who can't understand them through a mask. I know walking around my Highlands Ranch community, there is not a lot of mask wearing happening anywhere. It makes no sense for kids and teachers to not have to wear masks anywhere else but school. My kids don't understand why they're being singled out. Private schools are not masked and they are fine. Thank you for being brave and standing up for us. We really appreciate you. As an aside, I have noted that most people in all of these meetings that have been going on forever, that the people who get up to speak about helping our or keeping our kids masked take their masks off to speak. You do that so you can be understood. Enough said. Thank you so much. We really appreciate you.
Thank you. We'll take the next comment online.
All right, next comment is from an Aaron T. You are unmuted. Go ahead.
Hi, can you hear me?
Yes, we can. If you'd provide your name and address for the record, we'd appreciate it.
Absolutely. My name is Erin Turley. My address is 262 Agate Drive in Highlands Ranch. I come to you as a dedicated citizen. I've lived in Douglas County for a few decades and I've worked as a nurse. I provided care to your kids and now I'm providing care to our community who is sick and hurting and needs us. I am also a mother of 2 kids in school and I'm also a foster parent. My kids have realized the use of masks and when they're needed. When my kids are sitting in class next to classmates that might be sick or might not, they have an extra level of protection. I know this is a very emotional subject, but I can assure you for the past 18 months, I have been wearing a mask to take care of my patients for 12 to 16 hours at a time. I can articulate and my patients understand very important directions. All this is done without removing my mask. Masks are necessary. None of us like wearing them. As nurses, I am sick and tired of this, and I wish this pandemic would end. Very importantly, I want my children to be kept safe in school. If my children become unmasked and get sick, then I will need to stay home and take care of my kids. My husband is also a healthcare provider in the Douglas County community. I ask you to please consider keeping masks on in school for teachers and children. It is helping prevent the spread. We haven't even hit flu season yet, and we know, since we have lived in Colorado for many years, this can be a very detrimental season, especially to our pediatric population. So please consider keeping masks. It's working, it's science, it's data.
Thank you. Next online comment, please.
All right, next online comment is from an Aaron T. You are unmuted. Go ahead.
Next online comment, please. 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 Ne
Thank you, Mr. President. The next online comment will be from Matt Smith. Matt, you are unmuted. Go ahead.
I'm Matt Smith. I just walked in. Trying to make it. Yeah.
This is some timing.
I know. You like that? All right. Matthew Smith, SMITH, 3680 Penang Drive. So I'm here. I ran in, so excuse me. I'm a little out of breath, but I want to thank everyone for what they're doing. You know, there's no reason to mask children in school, and definitely not any reason to mask teachers in school. I'm not going to sit here and quote facts or statistics. I feel like, you know, we have a bunch of amateur scientists that have emerged over the last 2 years. And so I'm going to, you know, really lay off the facts and figures and leave those to the experts. But one thing I do know is anytime I go to a store and I try to talk to someone that's wearing a mask, I can never understand them, right? And so anytime there's plexiglass in front of me, I do this to go around it so I can actually have a conversation with someone. So these things are just barriers to learning. And, you know, my son right now, he's probably just getting out of school, not wearing a mask today here in Douglas County. And, you know, I can only hope that an order comes out today that, you know, makes that a legal maneuver, right? You know, I'm just waiting to see what the superintendent is going to send an email right after you guys vote. I'm sure we'll have something else to enjoy in our inbox like normal, but I really hope that you guys put teachers first, put kids first. Let's remove the mask. If people want to wear them, great. If they don't want to wear them, great. You know, so we're not asking you to order people not to wear masks, right? So we believe in choice. We want choice for the teachers. We want choice for the students. I think we all want the same thing. We want a great learning environment. We want an interactive environment. But again, we don't want these mandates. And like someone else just mentioned, it makes zero sense to walk into a school, be required to wear a mask, leave school and go anywhere else within the county and pretty much the state and not have to wear a mask. It just doesn't make a lot of sense, right? In full support of everything you guys are doing, thank you so much. And I'm really glad I made it by the skin of my teeth to address you in person because I feel that that's important. Thank you, and I relinquish the rest of my time.
Thank you, Mr. Smith. That we take the next online comment or in person if they made it here. Thank you.
All right. Thank you, Mr. President. Next online comment will be from Sean Benson. And go ahead, Sean.
Thank you. Check. Can you hear me?
Yes, we can. If you provide your name and address for the record, we'd appreciate it.
All right. My name is Sean Benson. I'm from Roxborough, Colorado. For security reasons, I'd rather not give my full address out. I'd just like to start off by commending the brave and patriotic leadership exhibited by our county commissioners in separating from the Tri-County Health Department and following the will of the people of the clear majority of this community. And to this board, I would like to thank you for being on the right side of history on this issue and giving parents and children back their health freedom by removing the mask mandate from schools. I think I speak for the majority of the county when I say thank you. Your efforts are not overlooked in this issue. I do have a couple questions, however. Perhaps it's my misunderstanding of the political process and the jurisdictional boundaries within our county. But why is the school board allowed to change their rules on who they have to listen to when it comes to this single issue? I'm sorry, I misspoke. Did I say school board? What I meant to say was, why is the unelected school board superintendent allowed to change his rule on who he wants to listen to regarding mask mandates? On August 17th, the superintendent sent an email to the district stating, and I quote, "Given that Tri-County Health Department has the legal authority to issue public health orders, DCSD is obligated to follow their mask wearing requirement," end quote. Then after waiting 6 days for the virus to recover from summer break, he decided that the mask mandate shall go into effect. On August 19th, Douglas County opted out of the Tri-County mask mandate, and the following day, the superintendent flip-flopped by sending an email to the district saying in bold font that Douglas County School District is a separate entity operating with its own policies, and that in alignment with DCSD policy, management is done in accordance with CDPHD or TCHD guidelines. Then, on August 31st, after Tri-County Health ruled that everyone must bend the knee and obey their mask mandate, the superintendent flip-flopped again by sending out another email going back to his DCSD is obligated to follow TCHD. Finally, on October 1st, immediately following the first official meeting of the newly formed health board, which ruled that Douglas County is no longer under a public health order requiring mask wearing in schools, the superintendent just came out and said it finally, saying that he will continue the mandate because he wants to, and mentioned some nonsense about following some restricted quarantine rules under Tri-County, of which we are no longer under their jurisdiction. Of course, we've already seen that Tri-County can quarantine an entire grade if they want to, as done at Willow Creek Elementary earlier this week. So this unelected superintendent went from we're obligated to we're a separate entity, back to we're obligated again, and to finally, I'm just going to do what I want. So my question is, what legal authority does this one person have over our kids' health? And why is that in the hands of one man and one man alone? I also have a question on what legal authority he or anyone in the school board has on requiring masks for everyone at the school board meetings. Does he or the board have the legal authority to require masks in a Douglas County government building, which is not a school? And that's, if I can get
your time
answers
is
to those questions, that'd be great.
Okay, thank you. We may get to those questions in discussion. Thank you for commenting. We'll take the next online comment, please.
Thank you, sir. The next online comment is from Dean Grice. You are unmuted. Go ahead, sir.
Good afternoon. Can you hear me okay?
Yes, we can. If you'd provide your name and address for the record, we'd appreciate it.
Absolutely. Dean Griss. I live in Parker, Colorado, 12147 Hadley Street. Similar to what others have mentioned already, greatly appreciate your willingness to review all of this. And I think that the biggest thing for me, everybody can sit down and cite numbers, data, studies. There's studies to support both sides of it. I've had the luxury over the past month to spend multiple days in my son's elementary school. And what the teachers and the administrators are doing is immensely commendable. And having the mask mandate in place, I think is unnecessary because they are teaching our kids how to be healthy, how to stay sanitary, washing hands, hand sanitizer, the whole 9 yards. And then when you look at all of the different things that they are doing, they're helping them become better citizens, and the masks are preventing a lot of that. You can even take it a step further, and there's even been studies that actually say with kids in these age ranges, when they've analyzed their masks after wearing them for an extensive period of time, they have found traces of various bacteria, everything that could be looked at from pneumonia, tuberculosis, meningitis, you name it, because of this extensive wearing. I think maintaining healthy practices on a consistent basis is worthwhile. And I think helping the kids be model citizens. So if kids feel that they need to wear a mask, or if the parents want their kids to wear a mask, that can be their choice. But the students, the teachers, and the administrators should, and we as parents have the obligation to make them great citizens and allow these kids to wear masks in their own free right and respect that. But it's not something that should be mandated because kids are very resilient. A lot of them rebound very successfully. And I think I just wanted to echo what has been mentioned already immensely a number of times. Thank you for your willingness to do this. I highly support removing the mask mandate for not only the kids, but especially the teachers and the administrators. Thank you.
Thank you. Move on to the next online comment, please.
Thank you. The next online will be Craig Landers. You are unmuted. Go ahead.
Great.
Hello,
Thank you so
Mr.
much for the
Landers.
opportunity. Craig Landers, 15864 Quarry Hill Drive in Parker. I have two kids in school, a 4th grader and an 8th grader at a charter school here in Parker. And I fully support ending this mask mandate, both for students and teachers. Please, it's so great to be heard. I never felt like I was being heard or listened to through Tri-County Health or Superintendent's Office or anything. And I echo much of what's been said, so I won't repeat, hopefully, too much of anything that's already been shared. But my own anecdotal experience, even last year, school year, when masks were required, I look at the school yearbook pictures, and there's so many pictures where the kids aren't wearing masks. So what difference did it really make when they were required? I would venture to say very little. And I think some of the original stats that were supported about 3.2 cases versus 2.4 support that. Makes very little difference. My fourth grader has an auditory processing disorder, and covering up somebody's mouth makes it much more difficult to hear for somebody at a critical stage in their learning experience or being in that grade level. And I also know multiple teachers that feel like it's an unnecessary hindrance, and just really hope this order goes through the right way and these kids can take off their masks. It's so unnecessary, but appreciate the work that you do, and thanks for letting us be heard.
Thank you. Next comment.
Next in line is Justin Wohler. Justin, you are unmuted. Go ahead, sir.
Hi, thank you. Can you hear me?
Yes, we can.
Great. Justin Wohler, 621 Stonemont Court, Castle Pines, Colorado. And I just wanted to say, just kind of mirroring some of the other participants, thank you, first of all, both sides of the aisle here. This is what community is about. And this is what important topics like this is all about, is having dialogue from both sides. With that being said, I only have one topic to bring up. I am a parent of an 8th grader, but I have one topic to bring up. Please do not disregard the Douglas County Teachers Union. My understanding is they fully support masking mandates, and I strongly advise, please take that into consideration. Thank you.
Thank you. Next comment, please.
Thank you. Next in line will be Laura Beeler. Go ahead.
Hi there. I live at 1528 Castle Creek Circle, Castle Rock, Colorado. And my name is Lauren Kennedy Beeler. And I just wanted to thank you very much for taking on this role that not all of us have the time, energy, or courage to do. I completely support the order, and I would completely support adding adults, whether it's the teachers or any other employee at the schools, to be included in the option to remove their mask. And I think it's definitely great to remember that the option is always there for adults or kids who want to keep their mask. And if they feel that that's what keeps them the safest, then that option is not ruled out in this order. And that is all.
Thank you. Next comment, please.
Next comment will be from Brandy Bradley, excuse me. You are unmuted. Go ahead.
Hey guys, it's Brandy Bradley, B-R-A-N-D-I, B-R-A-D-L-E-Y. I live at 6638 Lakeside Circle, Littleton, Colorado, 80125. I am the mother of 4 boys in Douglas County Schools, and I'm also a healthcare worker. I am calling in to fully support the PHO for mask choice. I applaud you guys. I feel so thankful, grateful, and blessed after attending every Douglas County School Board meeting and watching the 7 board members completely ignore parents and their rights. I appreciate the 3 of you for actually stepping up to the plate and listening to us and agreeing that parents should be able to decide choice for their children. And listen, if the data showed that kids were dying and that my kids were at risk, I'd be the first parent signed up to mask up my children, to vaccinate my children. But in actuality, it's just not the case. And the man that spoke about parents and grandparents dying, so we should mask up our kids. Have you been to a Broncos game, dude? Have you been to Coors Field? So our children should suffer because parents and grandparents are dying. Our kids should not be able to see their teachers and should not be able to listen to our teachers and should fall behind in school because parents and grandparents are dying. That's ludicrous to me. You need to look at the science and you need to look at the data and you need to support our Douglas County commissioners for putting our children first. That's what we ask them for. We ask them to keep our children safe and we ask them to put our kids first. And they're the only 3 in this county that is actually doing it. We have several private schools whose children have been unmasked through the whole thing and not a single COVID outbreak has happened. Unlike STEM school, who after the first 2 weeks of being masked up went on COVID outbreak status. I appreciate the three of you. I appreciate all you're doing. And I also support teachers being unmasked. Listen, we are adults. We can vaccinate ourselves. And if those work, then we should not care about what other people are choosing to do. I support mask choice. I support vaccination choice. Thank you so much for supporting us in Douglas County and for being fearless leaders. I appreciate the three of you wholeheartedly. Thank you so much.
Thank you. Next comment, please.
Next comment will be from Sheila Jones. You are unmuted. Go ahead.
Yes. My name is Sheila Jones. I live in Littleton, Colorado. My daughter and her family do live in Castle Rock, and I am a caregiver for my grandchildren who live there. And I am concerned about lifting the mask mandate. Many families, including myself, have people who are immunocompromised, and having children unmasked in the classroom increases the risk for those families. The news reports today talked about the large number of children who are now orphaned or have no caregivers because parents who had died or grandparents who had died from that. Also, recent news reports have shown that this pandemic has really impacted women because not having childcare or having to stay home when children are ill does cause problems. And I recognize that a lot of the students, especially those in the middle schools and the high schools, have the choice of being able to be vaccinated. Elementary children do not as yet. And what I would like to suggest is that the board, if they pass this, delay its implementation. The CDC is going to meet later this month, I think it's October 26th, to look at the issue of authorizing vaccines for children 5 through 12. It looks like that will probably go through at this time. And if it does, Douglas County is going to be on break for the next few weeks, and waiting and allowing parents who do want to get their children vaccinated, who do have family or children themselves who are immunocompromised, then gives those parents the chance to get their children vaccinated and to kind of level the playing field against this Delta virus that is having such ill effects on a lot of different people. I also would like to, point out that other cities are showing the same problem with schools masked and unmasked. I have a daughter who lives in Minnesota who teaches there as well, and her district just released data today for the last 7-day case rate for COVID infection per 100,000 students. And for those wearing masks over a 7-day period, the numbers went from just below 200 to just above 200 per 100,000, whereas those who were unmasked went from about 230 up to about 350 over that same 7-day period. So masks do make a difference. Masks and vaccines will soon be available. I think it would be worthwhile and considerate to give parents the option to have those elementary children vaccinated, before implementation of a
Thank you for your comment. We appreciate it. Next online comment, please.
Thank you, sir. Next online comment is from Teresa. You are unmuted. Go ahead. Oops, trying to unmute. Okay, unable to unmute Teresa at this moment. We'll move on to the next one, which would be Heidi Baskfield. Heidi, you're unmuted. Go ahead.
Thank you. This is Heidi Baskfield. I'm Vice President of Population Health and Advocacy with Children's Hospital of Colorado, located at 13123 East 16th Street, Aurora 845. I'm here to lend clarity to the statement that was made yesterday linking our state of mental health emergency to a mask mandate. Children's Hospital Colorado wants to make it very clear that there are no valid reports or scientific studies linking masks to mental health problems in children or any other group. There is currently no scientific evidence to support this potential concern. The mental health challenges that many children are experiencing are due to multiple factors. And we know kids are feeling more stressed and distressed than ever before. The major activities in their lives have been under constant change during the pandemic, and youth have been faced with prolonged periods of trying to cope with the unknown. Masks are not harmful to children's mental health. They need to stay in school and have connections with other kids and adults to improve their mental health. Right now, wearing masks is the very best way to ensure that that will happen. Kids and teens' mental health challenges existed before the pandemic. What has changed is that many of the activities that help them cope with these challenges, like school, sports, and extracurricular activities, changed significantly. Maintaining safe in-person learning, which is accomplished by wearing masks and getting kids vaccinated as soon as they are eligible, along with other protective measures, is a beacon of hope for our communities. Masks are a key to step on the road to getting back to normal and providing kids the support systems they need to thrive mentally, emotionally, and physically. Thank you very much.
Thank you. Next online comment, please.
Thank you, Mr. President. I do have a call-in on Robert Romanak. Robert, you are unmuted. Go ahead.
Great. Can you hear me?
Yes, we can. If you provide your name and address for the record, we'd appreciate it.
Yes, my name is Robert Romaniak, and reside at 3348 Soaring Eagle Lane in Castle Rock, Colorado. And I am a father of three beautiful children. They do go to school here in Castle Rock, and I just want to say extremely grateful for this vote you guys are putting forth. I am 100% against kids wearing masks in school, 100%. I believe it totally will put a, what do you call it? They'll just get regressed, and a lot of this most amazing time of their development, so much learning is happening. You guys just want to just put a stamp on that and just put them back. I think our kids need to be unmasked, get back to normal, see each other's faces, see each other's smiles, see their teachers' smiles too. It's so important. We got to get rid of the fear, because fear, nothing good comes from fear. And I appreciate everyone's comments that are for the mask mandates, but we got to get rid of the fear. And you guys, you commissioners, thank you so much for doing that. Get rid of the fear, get rid of the disinformation, because there's a lot of disinformation. Fear and the disinformation go hand in hand with this COVID illness. And I'm not going to tell you guys that I'm super smart about, science that I know all everything there is to know. I don't. And neither does the CDC, neither do the experts. This is a virus that's been around for less than 2 years. Who can become an expert, even if you've had 30 years of education or 30 years of experience and you've studied at all the Ivy League schools? You can't learn about something in 2 years, in less than 2 years. So there's a lot of unknowns, and but let's not give in to fear, and let's put the children first. I love my children. I would want anything ill to befall them. I'm sure every parent that's listening loves their children as wanting to befall them, but I believe this is the right choice. Let them learn, let them develop, let them see each other's faces. I mean, there's so much psychological, so much emotional. I know the person before me said, again, the test, how many tests have you run? How many sticks do you have to show that these masks are not going to mess our kids up? The only person that spoke about this is the surgeon that's been masked for his professional career. Yeah, I'm sure you're fine, buddy, because you've been masked after college and you've worked in a mask your whole life. I'm talking about our children. They're not even old enough to buy a pack of cigarettes, and we want to put them in masks. There's no certain research to show that it's harming them. I believe we should err on the side of let's not harm them and let them be unmasked in school. That's all I'm going to say. And thank you so much. Appreciate your time.
Thank you. Next comment, please.
Next comment will be from Dan White. You're unmuted. Go ahead, sir.
Hey, good afternoon, everybody. Thanks for making the the time to do this, to listen to us. I'm not going to take up entire 3 minutes, but I'm sitting here listening to.
Oh, would you please, I'm sorry. Would
Oh,
you
yeah,
please
yeah, my
provide your-
name. Yeah,
Thank
name.
you.
And yeah, no problem. So Dan White, I'm at 3967 Old Oak Street, Castle Rock. I got 2 kids in elementary school. So again, I'll just say a quick thanks to everybody, all the commissioners for doing what they're doing, to try to do what they're doing, to be representatives of us, or at least of the people that voted for you. I won't take up an entire 3 minutes other than, I sit here and listen to these phone calls and these web addresses and everyone becomes a statistician at this point. All I can do is say, I'm tired of it. There is not an emergency. I simply don't see that there's any reason for there to be emergency. When I look on Tri-County Health and I look at the data that's there, and you're talking about people that are under 74 years old, and there's a hospitalization rate of 2 per 100,000 people, which is a 0.003% of people being hospitalized. I just do not see the need for an emergency or the need for the schools to be putting masks and then leveraging them as that's what's keeping our kids in school. Oh, and now we want to keep our kids in school, and it's the masks that are letting us do this. It's just ridiculous at this point. I got really nothing else to say other than there's no emergency. There's no need for these steps to be taken. And I'm tired of being threatened that the reason these steps need to be taken is to avoid an emergency, and the cycle just keeps going round and round and round. So thank you for doing this, for listening to us. I absolutely support choice. If you want to wear a mask, you protect yourself, that's fine. If you want to get a vaccine, protect yourself, that's fine. You do not need me to participate in your safety. So I appreciate it, and I respect any choice anyone else makes. I just need my ability to make decisions for me and my children. Thank you very much.
Thank you. Next online comment, please.
I have no further online comment at this time.
Wonderful. Are there any additional comments in the room? Anybody who would like to have something to say that they haven't? Oh, thank you. If you just name and address, please, if you don't mind, when you get to the podium.
I'm Nancy Domries. I live in Inglewood, but unincorporated Douglas County, and I don't want to give my street address.
I understand.
So I wasn't coming to speak today, but in listening to everybody, I'm a grandma. I'm a great grandma. I have 11 grandchildren. 3 of them live in this county. I am a retired nurse. I worked in public health for 3 years, and I completely support what you guys are doing. It's been a really hard time. I've talked with fellow doctors and nurses that I used to work with, and they agree with me that masks really don't work, and that they just add a level of to keep the fear down. But it's causing more germs to be exposed, and they create the germs. And I watch the kids and I watch the adults and the masks that come on. And once you put a mask on, it's contaminated. And the minute you touch it, then you're getting those germs and you're spreading them everywhere. So I have that going. I have an 8-year-old grandson that doesn't live in this county, but he came home from school on Wednesday and said he wanted to die. And it breaks my heart. And he's not the only child, that's going through that. This has been tough, and we need to support our children. And I want to be a part of supporting. I talk to a lot of parents. I've gotten really involved with other parents in Douglas County that have children, and it's been hell for them. It's been really a hard time. So that's all. Thank you.
Thank you for your comment. It's helpful. Are there any other comments oh, yes, ma'am.
My name is Naomi Kay. I live at 2852 Rising Moon Way, Castle Rock. I am all for getting rid of the masks for these kids. I too, like the previous woman, am a retired nurse. Masks are not working as people believe. The virus can get through the mask, and as she also said, constantly readjusting that mask on your face over and over you're putting more germs up there than if they didn't have a mask on. And I have 2 granddaughters, and I hate seeing them having to wear masks. They don't get to see their teachers, their classmates smile at each other. It's fear, and it's politics out there, and people need to get over this fear. It's gotten to be ridiculous, and this virus is going to keep mutating, and what are you going to do? Mask these kids forever and ever and ever. I'm happy that you are doing this, that you're working for the benefit of our kids and the teachers. Thank you.
Thank you. And we have 2 comments, ma'am. I saw your hand first. If you would go, and then I will call on you, and then anybody else will go in order after that. Thank you. And if you just provide your name and address for the record, please, we'd appreciate it.
My name is Jane Bird, 9927 Boca Circle, Parker, Colorado. I recently, 6-7 months ago, moved to Douglas County from the city and county of Denver because they no longer listen to us in the city and county of Denver. So I was really happy to move to a county where you did listen to the people. I have 5 grandchildren that live in Douglas County and attend Douglas County schools. And I am also a retired nurse, recently retired. 25 years I worked in the intensive care nursery and pediatrics. And to expect children to wear masks all day in school is ridiculous. You see them drop on the floor and put them back up. They do become contaminated and end up causing more germs to stay on their face than not. And also, they're not getting enough oxygen into their lungs. They're retaining too much CO2. That's a scientific part of it. I've seen this affect every single one of my grandchildren in an adverse way. I have my oldest one here with me today, and he has, stood up and knows that he can wear a mask whenever he wants to, or he cannot wear a mask if he doesn't want to. And that's what I support. Everybody should have a choice. They shouldn't be mandated to do something. I am vaccinated, but if somebody doesn't want to be vaccinated, I think that should be their choice also. And that's what this country is all about, is choice and liberty and freedom. And throughout all this fear mongering, I think we have lost that. And I appreciate you listening to your people, and I appreciate your time.
Thank you. Ma'am?
Hi, my name is Sue Hahn, and I'm sorry I get emotional when stop it. Anyway, I just want to thank you so much for doing this for this county. I've got grown grandkids, I've got great grandkids, but they're not in school yet. And I would be very upset if they were having to wear a mask during that time. I've been vaccinated, I've had the COVID. So, I'm just not seeing that it's necessary to make them do that, because they are such beautiful children, all of them. And the teachers, I worked in a school, and I know that would be terrible, very hard to even express yourself with a mask on. But thank you again. I appreciate you. I don't know what else to say. Thank you.
Yes, ma'am.
Good afternoon. My name is Maggie Calvanese. I live at 7536 Pine Ridge Trail in Castle Pines. I'm fairly new. I'm from Pennsylvania. I'm a Philly girl, but I've been here for a couple of years, so I'm not too familiar with the county. I have a few questions I would like to present. I think it's wonderful that you're even hearing about what people's opinions are, that you have respect for us as we the people. I'm a constitutionalist, and I do not want to give up my freedom and my rights, my God-given rights that he has given me and planted me in this beautiful country that we're blessed to be in. But I have a question that I know you're going to make decisions on. You said that the teachers union are pushing for masks. If the children have to wear masks, there should be no exemption for any teacher. That's not right. If they're pushing for masks for children, which I disagree, I think parents have that right in decision. Then the teachers also have to wear masks. If there anybody that is pushing anything on anybody else has to be willing to do it. And that's only fair. And that bothers me when I heard that the teachers union are pushing for masks. I come from Philadelphia and it's a big union back east. And I feel, do what you're saying. If you feel that that's what you're going to push on children, make sure that you're pushing it on every adult. Though I do not believe in pushing anything on anybody. I have God rights. My freedom comes from God. It does not come from you people here or any government of this country. But I thank you at least for hearing us. Thank you.
Thank you. And I think we'll get to your questions when we have discussion among the board and we're voting. So thank you for that. And I would expect nothing less than a constitutionalist from Philadelphia. So do we have any other? Yes, sir. And then we're going to go back. I think there's some more online comments. No, please come up. And then we'll go back online and see if there's any additional comments there. Oh, yes, ma'am. Sorry.
Hi, my name is Alicia Carroll and I live at 15435 Winterleaf Court in Parker. And I did not plan to talk today, but I just feel compelled to. I have 2 children in Douglas County. And first off, I just want to say how much I appreciate your work and consideration to simply make masks a choice. I'm a speech language pathologist, and I have seen the clear impact on children's articulation, language, and social skills. I've seen firsthand the impact and the lack of progress on children's articulation skills because of masks. They've not been able to see the proper formation of sounds and words because of the muffling from the masks. They struggle to hear the correct production of sounds and words. They also are already hard to understand given their struggles, and then they put a mask around their mouth and their teachers and their friends really cannot understand them. They cannot see how we form sounds given our lips, our tongue, our teeth. It's a struggle for them, and the lack of progress has been significant these last 2 years because of that. And this is not even mentioning the children who don't have any of these struggles. Our young kids especially are at such a crucial time of learning letters, sounds, language, reading, social skills, and masks clearly have a negative impact on that development. Thank you.
Thank you. Are there any more comments in the room?
I have a quick question.
Yes. Sure.
After my screening here, I have 1 minute left.
Come on up. Come and re-identify yourself. And
I think it's really important.
Sure.
Matthew Smith again, 3680 Penang, and I'll be very fast. I did an open records request on Superintendent Wise's email, and I looked for a subject line that contained the school name of my child, and it was littered with complaints of parents snitching on every possible thing that you can imagine. Things like, I saw the principal outside today without a mask. My child saw the principal in the cafeteria without a mask. So, I really want to pass this along. I mean, I can go on and on. It was several megabytes of emails I got back from the core request. And so, we're really putting our teachers in a bad spot. So I really want to drive that home when it comes to the teachers. And the last question I have is, does Tony Spurlock give you guys snipers on the roof, or is that just for the school board? Thank you.
Thank you. Is there any other additional comments in the room? Are there? Okay. Let's go back online. I think there may be some additional comments there. Do we have any additional comments online?
Yes, sir. Thank you, Mr. President. I have Sophia Foss. Sophia, you are unmuted. Go ahead.
Hi, I'm a kid from Soaring Hawk Elementary. I'm Sophia Foss, Foss. My address is 3177 West Indian Summer Lane, Castle Rock, Colorado, 80109. I just want to say that masks are not helping the public learning at schools. They are limiting our learning progress, and they're just not helping. I come home every day with a headache because the masks give headaches to me, first because they're covering my nose and my mouth so I can't breathe, and they have trigger points in your ears that they pull on every day. I'm not the only one that comes home with headaches every day. I have 8 other people in my class that go home with headaches. And I just think it's not healthy to have a mask on. It's not helping us. And if something's happening to our parents, it's not our fault. It's not our fault that they're getting headaches. It's not our fault that they're getting sick. So I just think that it's not our choice. It's a free country. I just think that we should have a choice in what we have, which is not what we have right now. Thank you.
Thank you for the comment. Are there any other online comments?
Yes, sir. I have Katie Webb. Katie, you are unmuted. Go ahead.
Thank you so much. First of all, I have already spoken before you guys before, and I really appreciate all you're doing. The county commissioners, I appreciate this Board of Health. I just wanted to echo what most people have said here, that I just want us to have the freedom to choose. Those that want the mask mandates, they have the freedom to choose for their kids to, have their kids wear the mask. We're not getting up here telling you, you absolutely can't wear a mask. Those that don't believe in the mask, we just want a choice. And I think that's the right thing to do. I do have 3 kids in the Douglas County school district. One of them, I got a doctor's note for her because she has allergic reactions to the mask. But it's just wrong. It's wrong and you can find studies on both sides. But personally, I just think this should be a choice. And if people are scared and they don't want to send their kids without masks, they have the options to stay home, do online school. It's not my kids' responsibility to protect them. Again, if they think the masks work, then they can wear them and, they can feel protected that way. So again, I just wanted to echo what everyone else has said and thank you guys. And I just hope that we can see something happen, see a difference made soon. Thank you.
Thank you. Next online comment, please.
Thank you, Mr. President. I have Marissa Buzan or Buzan. I apologize for how I pronounced your last name. You are unmuted. Go ahead.
Perfect. Thank you so much. Can you hear me?
Oh, yes, we can. If you provide your name and address for the record, I'd appreciate it.
Absolutely. Marissa Buzan. My address is 18110 East Peakview Avenue in Centennial, Colorado. I do have children in the Douglas County School District and want to also, they're at charter schools and I'm on the charter school board. I am also a proud graduate of Douglas County Schools. Sorry. I don't have anything else to add other than to thank you all for being kind, respectful, functioning, organized group of human beings. You've been in existence for less than 14 business days, and this is by far already the most organized health department meeting I've ever attended. I applaud your efforts. I appreciate your time and dedication, and it does not go unnoticed that you are standing up for what your citizens are asking you to do. I'll relinquish the rest of my time and just please know how thankful we are for you.
Thank you. Next online comment, please.
Thank you, Mr. President. I have no further online comment.
Thank you. We will now then close public comment and we will move to motions. Yes, we'll move to motions. Let me talk a little bit about the process moving forward, just so we're organized about it. I will open up the I'll open up motions, and if somebody wants to amend the order, they should make that motion, and then we can discuss that motion, and we can discuss the underlying order as well. And then when we go to vote, we'll vote on any amendments to the order, and then we'll vote on the order. Do I have that process correct, Council?
I believe that is correct. That's a perfectly plausible way to move forward. I think typically we do a discussion, not necessarily, we don't have to start with the motions.
Okay.
Everyone can have a chance to speak their mind.
Okay.
And then if anyone wants to say, offer a motion at that point is typically how we proceed.
Okay. Well, I'm caught between plausible and typically, so I'll go with typically. So why don't we have discussion and then we can move to motions, but we will then proceed. If anybody has an amendment, we'll take up the amendment and then we can then move on to the the base order. So let's open it up for comment. Any comment from the board members?
Actually, I do have
Yes,
one
Doctor.
comment, and I just want to correct a misperception. We actually do have a flu season this year, and this is from John Douglas's data at Tri-County Health, which he presented last month while I was still a member of that board. And that is that there's something called RSV, respiratory syncytial virus, and we are seeing 3 times the cases of that to 1 case of COVID. So flu season has started, and not every sniffle your child has is going to be COVID.
Thank you, Doctor.
If I may, Mr.
Well,
President.
Mr. Bracken, yes.
Thank you. Yeah, so I'll point to the comments that I made our last board meeting. The percentages of folks that are vaccinated across our county is extremely high. The folks that have had COVID is really not been discussed by and large and taken into account by Tri-County Health. While Dr. Douglas on our calls has acknowledged that that is a factor, still hasn't visited it or commented to the remainder of that. So the original reason why Dr. Douglas gave when we were on the Tri-County Board of Health together, the original reason why the mask mandate was in place per his organization was that the younger children could not be vaccinated. Well, as I mentioned on our last Board of Health meeting, it was almost, I believe, 57% of children from 12 to 15 are vaccinated. And again, it doesn't take into account the ones that have been, that have had COVID. So I think this is a very reasonable action in terms of allowing folks to make their choice to protect themselves, and then allow the folks that if they have somebody at home that's vulnerable, if they have so many loved ones that they need to protect, it is their responsibility to protect them. It's not everyone's responsibility to protect them, given the numbers that are currently in place across our county in terms of vaccination, in terms of contracted COVID, and in terms of coverage in antibodies and the like. So those are my comments. I think this is a very forward-moving action, and I look forward to hearing the motion.
Thank you. Any additional comment from board members?
Mr. President, if I
Yes,
might.
Commissioner.
I spent a lot of time going over this public health order and reading it carefully. And I just want to point out some things that I think are really pertinent and important as we look at this entire public health order. First of all, there's a whereas that talks about the Colorado Department of Public Health, their website, and it says schools and districts should work directly with their public health agency and the Colorado Department of Health and Environment for guidance on COVID. And that this board is concerned about the growing mental and emotional health issues for our school-aged children. I served as the county coroner in this county from 2011 and 2000 to 2015. And I've said this before, but I sat in far too many kitchens with families who lost a loved one to suicide. You never know where mental health is going to erupt or how it's going to manifest itself. But if we have any inclination that there is a mental health problem, it is our responsibility to address it. I was really disappointed to hear someone from Children's Hospital call and say that there is no indication whatsoever that masks are detrimental, when we have sat here and listened to parents over and over in the room, online, emailing us, calling us, texting us, telling us the impact of wearing masks, what the impact of wearing these masks are on their children in school. And that is one thing that I believe this board is certainly taking into consideration as we look forward as to what we're going to do. I'd like to point out another whereas that on May 14th, Governor Polis ended the mask mandate in Colorado, stating it is the policy of the state of Colorado that the decision whether to wear a mask or not should be left to parents and students. This is now a quote. Where we have come out is that you absolutely can wear a mask. even if you live in a district that doesn't require it. It's a decision that is a good decision and one that students should make, particularly if they are unvaccinated. Yet he is saying that people should make the choice. There's another highlight in here that talks about the yearly rate of children who are dying from COVID is 302 individuals per year, which is sad for any parent. I'm not saying that that's okay. That's the number. Yet when we talk about the last 10 flu seasons, the average was 452. So it seems to me by looking at this data that flu is more dangerous than COVID. There's more really good information in this public health order. And I would ask that all of you read everything that's in this order, just not one or two statements that apply to a particular issue that you are interested in. Thank you.
Any other comments from board members?
Thank you, Mr. President. Thank you, Commissioner, for bringing out the data that's actually supporting in this order. Several of the comments that have been made, and it's not that they've just been made today, it's that they've been made for the last 19 months, is talking about what is known and what is unknown. And, you know, I think it's been said earlier, just today, but it's been said a lot. There's a lot of cherry picking of data that occurs. There's a lot of finding data to put forward an opinion. I think we've seen that at many levels of our government. But the bottom line is there's a great deal of data there. And as a guy who's worked for a generation in the software industry, you know, the data is only good as the source that you get it. I'm sure there are very good sources of the data that has been bandied around the last 19 months, but it still just brings us back to the comment that was made several times today that we just don't know. That there is an unknown factor in what all of this data means. We do hear it from, we have heard it in the past from Dr. Douglas at Tri-County, that we know certain things and that thereby causes them to suggest something or perhaps order something in the nature of public health. But then it always seems to come back to, but we just don't know. There's an unknown factor. And because there's an unknown factor, we continue to err on the side of addressing our inherent liberties, the inherent ways that we've all chosen to live our lives prior to the year 2020, and the way that we've chosen to organize our governments, to organize our schools, and other civic organizations. And if there's anything that I hope this does, is that if I would hope that this board will look at the factors that are still unknown. I mean, I think we can acknowledge that. And yet understand it is indeed our job to make the decision on, well, what is known that is pertinent to public health here in Douglas County, and what is unknown that is not pertinent, and that we would take a step towards using the data we do have, the data we are certain of, in order to move forward. Thank you, Mr. President.
Thank you. You know, in considering whether to vote for this public health order, I started from the presumption that we don't mask children unless there's clear and convincing evidence that it will provide protection from COVID or its variants. The burden on this board, the burden on public health, isn't to have people demonstrate that it doesn't work. When you're talking about masking children, the burden is on those who promote that. You know, while masking may have become a controversial issue, this board isn't considering ideological viewpoints on this. We need to consider if the evidence has been presented that requiring children to wear face masks is a benefit. At the beginning of the pandemic, the reaction of public officials was to do everything possible to protect the public health, and that was warranted. We didn't know what we were dealing with, and we needed to react to that uncertainty. However, after 18 months of a pandemic, parents and communities are starting to ask, why is it a benefit to mask children? Is there evidence that clearly paints a picture that masking for extended periods of time works? Communities deserve from their public officials that level of explanation before being told they should put masks upon their children. I have not seen the clear and convincing evidence of the benefits of maskings. And I'm not anti-mask and I'm not pro-mask. But what I want to know is that if I'm going to be dictating a masking requirement, that I can say unequivocally that it will provide more benefit than not. Can I explain to parents what the benefits and downsides and demonstrate to them that that calculation is in favor of the benefits? Well, I have not looked at every study. I have pulled several, and they may not be dispositive of the issue. But they certainly caught my attention. There was a CDC study of intervention strategies in the state of Georgia. While the study did recommend masking for unvaccinated children under 12, it also recognized that a lower incidence rate of COVID transmission in schools was not statistically significant. So they recommended masking, but then they also recognized that the study's data was not statistically significant in order to support that finding. What we need to be able to do is to demonstrate to you, to demonstrate to parents, yeah, there is a huge benefit and we have the data to prove it. This is the issue. Parents want to know that if masks are going to be required, their use will make a difference. There was another study, the American Academy of Pediatrics looked at, among other things, they examined different states and cases per 100,000 of COVID in children. When you look at the states and the incidence rate, it was cumulative since the beginning of the pandemic. When you look at the incidence rate, it's difficult to find clear evidence that states which are masking are having lower incidence rates. For example, Connecticut, according to the study, has had, since the beginning of the pandemic, about 10,023 cases of COVID in children per 100,000, and they still have a stringent mask mandate. Colorado has an incident rate of 85-95, and we do not have a statewide mask mandate. Alabama has 4,900 cases per 100,000 and has not had a mask mandate since April. While Delaware requires masks in school, and their rate among children is 10,843. Again, I don't know that this is dispositive of the issue, but what I do know is that if I'm going to look at you and say that we should have masks, I should be able to explain why those masks are necessary. And there could be other numerous differences that account for this that have nothing to do with mask mandates. But what it doesn't demonstrate is that we should be putting masks on children. Finally, I want to note this. There was an author, an article that recently was printed by Vinay Prasad, who is a biostatistician, teaches at the University of California, San Francisco, a well-regarded person who she made this note. And the article is noted that the basis of the article is that any health benefit of masks are smaller or diminished significantly by the educational impact that masks are having in children. And she noted this: scientists have an obligation to strive for honesty, and on the question of whether kids should wear masks at schools, particularly preschools and elementary school, here is what I conclude. The educational harms of mandated mask policy are more firmly established. So this is where we're at as a board. We're trying to find the best way forward, but the best way forward isn't to put the burden on the public to come to us and say, show us studies about why masks shouldn't be on children. The burden is on us to demonstrate evidence and explain it and explain the pluses and the minuses of masking, and then say that we have come out for masking. And from my point of view, that evidence isn't there, and I am open to further discussion on that. With that, unless there are other comments from board members, Mr. Pratt's going to correct me.
Not from board members, but there was an email, two emails actually, that came in regarding this subject for your consideration. They were not included in the public comment. They didn't get noticed until after we had closed that. If I could, I'd like to, one of them is simply a written statement from Children's Health that I believe was read into the record by one of the commenters, so I will not give that again. The other is, if I may.
Yes, please. Please.
The other is a comment from a Holly Adams of Parker. ADAMS. And she states, this order is a lawsuit waiting to happen. If any kids die from COVID after you defied Tri-County's masking order, their parents are going to win big in all the lawsuits they're going to file. This is a bad idea. I just wanted to make sure you had all of the comments that we received.
Thank you. I appreciate that. So with that, the order is entered into the record, and I would accept any motions if there were any amendments to the order.
So first of all, Mr. Chair, if I could just, I'm sorry, Mr. President, I'll make a motion that this board approve a public health order allowing exemptions from facial coverings and preventing quarantining of asymptomatic children.
Second.
A motion has been offered and seconded.
And Mr. President, if I may, I'd like to offer two amendments. The first amendment is actually very administrative in nature and would just correct the effective date that is noted on page 15 to reflect a change, move to amend to reflect an effective date of Saturday, October 9th, 2021 at 12:01 a.m. And Mr. Chair, I would offer that if the motioner and the second find that sufficient, that it be accepted as a friendly without further vote.
Any objection?
I have none, and I would accept that.
Okay. It is accepted and adopted.
Thank you, Mr. President. For the purpose of making an additional amendment, I was very inspired by the message that Commissioner Thomas offered up in initial comments pertaining to this order possibly having pertinence to teachers, but also administrators, staff in schools. But I would offer an amendment that actually goes to reaffirm the position that Douglas County has held for several months now from the Board of County Commissioners, to wit, move to amend the public health order, paragraph A1, which states, unless required by other state or federal mandate, comma, certain children, I would amend, and adults shall be exempt from any requirement to wear a face covering within Douglas County, comma. If that amended person or, and then continue to read child's parents, guardian, etc.
Okay.
That is my motion. I ask for a second.
I'll second that.
Thank you. Is there, and let me just stop here for a second. Ms. Pratt, does that cover the waterfront on this issue?
I'm not sure that entirely, if I count correctly, there are probably about 10 places at least that we would have to make changes in this document to affect that.
Let me suggest this then, that we discuss and vote upon Commissioner Teal's amendment with an addition that staff is authorized to make conforming changes to the rest of the order.
Just for clarity, Mr. President, let me withdraw that motion and do a substitute motion to direct staff to amend the public health order to make it clear that adults are included in the ability to be exempt, are included in the provisions of this public health order, and that, and there is no, and that would be my motion.
Is that should cover the waterfront? That should reach where what the commissioner is trying to reach, correct?
I believe so, correct.
Okay, great. So we have a second. We have a motion. We have a second. Is there discussion? Okay. Absent discussion, then I will ask for a vote. All in favor, say aye.
Aye.
Opposed? Okay. Great. So now is there any other amendments to the order? Okay. So now it has been moved, the order has been moved and seconded already, I believe. So now all that is required is a vote. If absent further discussion, I would ask for a vote. All in favor, say aye.
Aye.
Opposed? Aye. I didn't say aye. Opposed? No opposed. Okay. Wonderful. So let's move on to the next item on the agenda.